So I'm at the CCG, which is the Clinical Commissioning Group, which is the health authority, which is responsible for all commissioning of health services in Cambridge and Peterborough. And the Princess of Wales and what's going to happen to the Princess of Wales has been a real issue over the last year, because there was a threat of closure last year, which the local community got behind. And now it's really good news that not only is the MIU not closing, but there are actually increased services operating there in a pilot scheme. So I've just met Gary, who is the chair of the CCG, to discuss with him how the pilot's going and to see whether it's going well, so that we can maintain the services at the Princess of Wales that I know everyone in Ely wants to maintain. So Gary, how is the pilot going?
Well, we started back in May of this year by having GPs working in the minor injuries unit on a rotational basis. So Monday to Friday, 9 to 5, we've got GPs within the service, and that's enabled the nursing staff that worked at the minor injuries unit to work at the top of the skill set, because they're better supported by the GPs that are present there, and also means that patients that are going into the unit are less likely to get referred on to the emergency department or back to their own practices if it's a problem that the nurses alone wouldn't be able to deal with. It's still very early days at the moment, but we're looking at a number of ways we can work with the ambulance service and local practices to expand the number of opportunities for patients to be seen at the minor injuries unit, to help both with capacity within the practices themselves, but also meaning that patients get treated locally and close to home, which is the very strong message we got from all the meetings we held with the community last year.
Yeah, great. So are you pleased with the way that the pilot's progressing so far?
Yeah, at the moment, GPs are under a lot of pressure at the moment, and anything that helps the practices provide a service to the local community, but also means we can free up some GP time to get them helping the other services. The NHS sometimes feels really fragmented, but if we can all come together and provide these services in an innovative way that uses the workforce we've got to its top ability, then that's got to be good for everyone.
Thanks, Gary.